Hello, friend. When OCD is in your life, whether you're an OCD warrior actively managing your own obsessions and compulsions, or you're an OCD champion caregiver supporting somebody you love with OCD, chances are good that you've had times when you say, "This just isn't working." You might tell a very specific OCD story. It's the story of desperately wanting things to get better and the massive and sometimes futile efforts to find the right help. Your OCD story might include the years you spent in pain before you were diagnosed, or the years you invested saying yes to treatments prescribed by people you trusted that really didn't help. It's a story that you would not tell if you had diabetes or breast cancer or even ADHD. Why is getting stuck such a universal part of the OCD story? That's the topic of this podcast episode. Well, welcome to the Free Me from OCD podcast. We're here to offer educational resources and coaching and community support to help you say yes to your life by saying no to OCD. I'm Dr. Vicki Rackner, your host. I call on my experience as a mother of a son diagnosed with OCD when he was in college, surgeon, and certified life coach to help you get in the driver's seat of your life. My vision is to help you move forwards in a future in which OCD is nothing more than the background noise of your full life. This information is not intended as a substitute for therapy. It's just an adjunct. So let's dive in. Almost a month ago, I read an article called "Letting Naomi Die." The front cover of the magazine says, treatment wasn't helping her anorexia, so doctors allowed her to stop, no matter the consequences, but is a palliative approach to mental illness really ethical? I'll leave a link so that you can read the article yourself. Naomi struggled with eating disorders since childhood. She'd tried every treatment, and nothing brought the hoped-for cure. So here's what the article says. It's just such great language. She collapsed into her 30s. She had no hobbies and no friends. She had become a kind of professional patient. Her whole life whittled down to the airless world of her diseases, the logistical management of her self-denial. Everything was epic drama, but also staggeringly boring. To Naomi, her doomed attempts to get well had started to feel less tragic and more ridiculous. It wasn't so much that she wanted to be dead, at least not most of the time. It was that she could no longer stand anyone trying to cure her, especially because the cures were always the same and never worked. She told the author, "I'll either die of anorexia or I'll die of suicide." Then, one day, a nurse in her inpatient treatment center gave her an article about palliative care for anorexia. She, Naomi, emailed the article's author saying, "Dear Dr. Yeager, after 20 years of trying the same thing over and over again and expecting different results, I'm tired of fighting the system." So Naomi wanted to explore this palliative psychiatric service. She was willing to take treatments that would make her days better, like IV electrolytes, but she didn't want any more curative treatment. No inpatient care, no forced weighing or feeding, no efforts to be fixed. This article hit my soul. I've been digesting it for about a month, and I'd like to share some thoughts. As a physician, I see the tremendous value that hospice and palliative care professionals offer. For some of my own patients with advanced breast cancer, there comes a time when it makes sense to shift from the goal of having more days in their lives to more comfort and joy in their days. But these can be heart-wrenching choices. I remember a dinner party in which the host, who was a primary care physician, talked about a conversation he just had with some parents. The parents told them that they just learned that their 6-year-old son had the third recurrence of an aggressive brain cancer. The child's oncologist found a new treatment trial, and the parents asked the doctor, my host, what should they do? Should they leave their family and friends to move to Texas for more treatment, or should they go to Disneyland? And around the table, we were just curious. We asked, well, what did you advise? He said, tough choice. I supported the parents' hunch that Disneyland was their better choice. Naomi wanted the Disneyland choice for her anorexia. I had to wonder, what if Naomi had OCD rather than anorexia? How many people with OCD give up on OCD treatment and want the Disneyland plan? What happens when someone with OCD says, enough, no more treatment? Maybe this person is or was you. Maybe this person saying that was somebody that you love. I've been there myself watching my son wrestle with OCD. The truth is that OCD is treatable. It's manageable. So how do you break through the despair and be open even to the possibility of a better tomorrow? I think it begins with telling the truth of where you are today and understand how and why people with OCD get stuck, why they come to this choice to give up on treatment. That's really what I'd like to talk about today. Here are the top 3 reasons I see. Number 1, healthcare professionals' limited understanding of OCD. Yes, sure. I took a psychiatry rotation when I was in medical school, and I was told, yes, there are some people out there who wash their hands and count things who are hard to treat. But even trained therapists are often not equipped to ask the kinds of questions that lead to the diagnosis of OCD. So let me get back and read from this article. And I'm quoting here. The doctor remembers Naomi saying, I have these obsessions. They won't let go of me. Nothing they have ever given to me in therapy has ever changed those infernal thoughts. Now, don't you just love that language? Infernal thoughts. Did your OCD alarm go off as I read those words? According to the article, Naomi carries the diagnosis of eating disorders and bipolar disorder. It's theoretically possible that over Naomi's many years of treatment, in the hands of who knows how many healthcare professionals, somebody considered the diagnosis of OCD and ruled it out. However, if I were a betting person, I'd wager that not one of them asked, are we missing something here? Could OCD be part of Naomi's clinical picture? When healthcare professionals don't ask, could this be OCD? They don't diagnose us. And when you don't diagnose us, you don't offer treatment. And even if you know that this person needs treatment for OCD, if you don't invest in your own professional development, you might offer treatment that actually makes OCD worse rather than better. Well, here's some good news for you. You're listening to this podcast because somebody asked the question, could this be OCD? Since you're here, you know the right evidence-based treatment for OCD. It's exposure and response prevention, or ERP. So I'll leave a link about a podcast episode about what OCD is and another link to NoCD where you can find a trained ERP practitioner. Problem number 2, our limited understanding about what actually happens in the nervous system that leads to the obsessions and compulsions. My son has OCD. I don't. Still, when he describes his obsessive thoughts, I can honestly say I've had every one of them myself. My son and I are having a shared human experience. So why is it that I can have a thought and let it go, when my son takes this same thought for a drive around and around and around a thought traffic circle for hours? If I were to sit down with even the most sophisticated and knowledgeable neuroscientists and ask, how are my son and I different? The answers I get today are not very satisfying. They're incomplete. Most importantly, they don't necessarily help my son live a better life or guide me to be a more effective parent. I remember being at a mommy group led by a great parenting coach. One day, a mom said, "Sometimes I am just so exhausted by the constant power struggles with my daughter that I fantasize about just leaving my daughter in the grocery store cart and driving off without her." Now, we all laughed. We'd all been there. And then we moved on. Someone with OCD might not be able to move on. They might judge a thought like this and say, "What kind of terrible person am I to think this thought?" They might say, "Well, if I think it, it must be true." They might have the real fear that one day they would actually leave their daughter at the grocery store. They might be concerned enough so that they might never bring their child to the grocery store. Maybe they decide to give up grocery shopping altogether. So imagine a Grand Canyon. On one side, there's the practical, actionable interventions that could help her mom go grocery shopping. And on the other side is the body of scientific knowledge about OCD, about exactly why she went down this cycle. Our shared vision is that one day we can build a bridge that spans this gap, that science will inform effective treatment. Now, there are interesting possible clues all around that might contribute to the bridge's construction. I read an article about how the parasite Toxoplasma gondii affects the brain. Now, if you've ever been pregnant, you know that you have this parasite to thank for your 9-month break from kitty litter duty. If your cat's infected, the eggs, called oocysts, can pass into the feces. And then you could become infected through exposure to the cat poop. And the infection is highly dangerous to developing fetuses. Well, here's something that you might not know. The Toxoplasma parasite has 5 stages in its life cycle. The stage in which the parasites reproduce only happen in one place, the cat's gut. Well, mice can become infected with this parasite as they walk around cat poop. The infection changes their brains. It turns out that infected mice lose their fear of cats. They scurry more. These behavioral changes triggered by the infection makes it more likely that the cat's going to eat an infected mouse, and that allows the parasites to reproduce. You have to marvel at the sophisticated engineering that protects the parasite's survival. Could a pathogen trigger observed OCD behaviors? Sometimes kids diagnosed with strep infection will develop suddenly OCD symptoms. It's called pandas. When Crohn first described what we now call as Crohn's disease, he thought it was caused by an infection, but ultimately came out and said it's an autoimmune disease. Goats get a disease that looks like ulcerative colitis that's successfully treated with an antibiotic given for TB. There's hotspots of multiple sclerosis. Could infection play a role in triggering OCD? What role could the nervous system play in the development of OCD? Safety and danger are central themes in OCD. We're in the middle of award seasons right now. Many celebrities travel with security. You just don't see them. Prince once brought his bodyguard to the stage when he accepted a music award. What if people with OCD, like my son, have their own bodyguards that go everywhere with them? How and why does this personal bodyguard step forward? When our lives are threatened, the autonomic nervous system prepares the body to fight or flee or freeze. What role might the autonomic nervous system play in the development of OCD? People can acquire the skills to calm the nervous system with body-based somatic treatments. Will this be part of the OCD treatment protocol? What can we learn from people who treat trauma and PTSD? I've witnessed with my own eyes the transformational power of a treatment that involves rapid eye movement or any signal that crosses from one side of the brain to another. Maybe breakthroughs in substance abuse or eating disorders can help crack the OCD code. I've saved the third biggest reason for last. OCD spins a sticky web of control. If you're an OCD warrior, you know that OCD wants to control your life. Even Toxoplasma's cat and mouse shenanigans are nothing compared to OCD tricks. OCD takes control of its host, the person with OCD, their environment, and their schedule. And then they even control the people who love them. Well, how does OCD do this? First, OCD has a sneaky way of tapping into the brain's vulnerability. Think of the brain as a 3-story house. On the top floor, there's the prefrontal cortex, the planning part of your brain. This is the part of the brain that can imagine a different future, that asks the best questions and comes up with the best solutions. In the basement, there's your reptile brain. This is the part of the brain that's active when your life is threatened. The reptile brain only knows how to do 3 things: fight, flee, and freeze. So, when OCD offers thoughts of danger, it's like somebody pointing a gun at you. You don't stop and ask, well, hey, is that a real gun or a toy gun? You run. You ask questions later. You want and need your prefrontal cortex to manage OCD and create the life that you want. But OCD makes it hard for you to access it. My son has OCD. I was diagnosed with ADHD when I was 40. These 2 different flavors of neurodiversity impact our lives in very different ways. I could live a normal life with undiagnosed and untreated ADHD, or what looked like a normal life. I got through medical school. I became a surgeon. Sure, I might miss a flight if I got really curious about an idea and went on an idea safari and lost track of time. I once almost missed a flight when I was sitting right in the boarding area. However, ADHD kept me from a great life. I'd start a project and then get bored and jump to another project. But through it all, I had access to my prefrontal cortex at all times. I could bring my highest and best self to managing my brain. That's not how it is for people with OCD. It's like their brain is hogtied and blindfolded by OCD. They have limited access to the part of their brain that will help them get back in control of their lives. This is why OCD is so disabling. This is what keeps people with OCD from leading normal lives. And that's just the first trick that OCD has. So once OCD has its hooks in, it gaslights you. It delivers messages that you can't believe what you see with your own eyes or hear with your own ears. It tells you that your perception is off, your judgment is off, your memory is off. OCD takes control of its host by sowing seeds of doubt. Some people call OCD the doubting disease. The OCD gaslighter says, you know you can't trust yourself. Trust me instead. Then OCD grooms you. It asks you to do one small thing, then another, then another. Over time, the boundary between what's acceptable and what's not acceptable shifts. So OCD can take control over the environment, about how you spend your time, over what activities you're allowed to do. Once OCD has control over its host, the person who owns the brain where the OCD sets up control, then it's time to entice others into its web of control. Now, if you were trying to get control over somebody's parents or partner, how would you do this? Well, you might prey on the human propensity to protect the people we love and do what we do when they're in pain. These are programmed into primitive parts of our brain. Well, that's just what OCD does. OCD now grooms family members. Before long, family members become part of the compulsions. I saw this happen in my own house. I saw the way that OCD took control of my family. Now, my son struggles with moral OCD themes. He has obsessive thoughts about how he lied or cheated or let a friend down. These thoughts would make him feel very anxious. To get some relief, he'd replay scenes from his day over and over and over again. Then he'd go and make confessions or ask for apology. Over time, he reached out to me for help. He wanted me to sort through this sandbox of his daily conversations and find the broken shards of glass, the thing that he said or did to hurt others. Then I would offer him reassurances. No, that's a perfectly acceptable to say or think. So that sounds normal, right? That's what I do for any friend. But actually what was happening was I was now part of the compulsions. Now OCD had control over me. I even did this once I knew my son had OCD. I just didn't know what I was doing. Once I figured this out, the obvious solution was getting my son under the care of an OCD practitioner. He resisted. I pushed harder. Now I was trying to control my son. And before long, my son and I were not on the same team battling OCD. Now we were battling each other. I just imagined OCD celebrating this conflict between my son and me. It just made it easier for OCD to maintain control. And then OCD has a final trick up its sleeve. OCD tells you that there's no hope. It tells you that you will not escape its power. Your future is going to be more of the same, only worse. And that's the thought that leads to despair and hopelessness. You can see how OCD is a formidable foe. Yes, people with OCD choose the Disneyland option when they've tried things that haven't worked. If you know anyone who thinks that they can't take another day of this pain, take action. Have them call 988. Get them in for evaluation. But this is not what most people want. They just want a way to get unstuck from OCD's control and live their life. So here is the truth. You didn't do anything wrong. You're not broken. This is not a helpless and hopeless situation. I will tell you that there's a way out. I found it for myself and my family. I've helped other families find it. And you too can be freed from OCD. So let's get back to the bigger question. What do you do when you think nothing is working? I'm just releasing the idea of having a good life. Well, it begins by knowing that you're not alone. Of the people I know touched with OCD, 100% of them tell me stories about the many ways they're let down, of the doctors they trusted who missed the diagnosis, of the well-intentioned health care professionals who offered treatments that didn't work, of the well-intentioned family and friends who said things that just made the person with OCD think, do you really get what's going on with me? Sometimes the first best step to getting to where you want to go is just by stopping, seeing where you are now, and considering that you got here. So I invite you to just sit with the reality that your OCD story includes disappointment. This is completely normal. Well, where do you go? What do you do? The first idea seems kind of weird. It's just to tell your OCD story. I've attached a link to a worksheet where you can download my OCD story worksheet, and you can actually record your story there. Maybe you just pull out a pencil and paper and start writing it. I recommend physically writing it because you access different neural circuits of the brain. Maybe you prefer to tell the story with spoken words, so you can dictate it in your phone or maybe even tell a friend. So you might want to address things like, when did you first notice your OCD-related behaviors? What happened next? To whom did you reach for help? What kinds of treatments did you try? What makes it better? What makes it worse? Now, this doesn't have to be a perfectly constructed story. Just get the thoughts from out of your head and onto paper. Don't worry about grammar or spelling or punctuation. Let it just be stream of consciousness. Now, Ellen said it was like I was vomiting on the paper. And then here's what she wrote. I tried everything. Nothing's ever worked in the past, so nothing's going to work in the future. I can't see a way out. My therapist told me there's hope for a better tomorrow. I don't believe her. So if you're an OCD warrior, your story will be focused on the ways in which OCD has control over you. If you're an OCD champion caregiver, your story is still how OCD impacts your life. But it's the twist. What's it like for you to witness someone you love in pain? What's it like to watch them resist treatment? What's it like to have this power struggle between the two of you? Now, you might notice strong feelings like anger or betrayal or disappointment. Give yourself permission to feel these feelings in a safe way and a safe place. Maybe you do this in a therapy session. Let those tears flow. Punch a pillow. Think about what you'd say to the doctor who missed the diagnosis or the friend who said to you, "Why don't you just stop?" So here's another action step that you can take. Give OCD a chance to tell their story. Recently, I attended a book group and the leader asked, "What's your most memorable costume you wore to a costume party?" And I immediately knew the answer. I was once invited to a costume party in which guests were invited to dress as the embarrassing, shameful parts of themselves they work so hard to hide. So one person came dressed in a fat suit. He'd never been overweight, but he's terrified that one day he'll be obese like his dad. So he carried around a bag of junk food and regularly delivered fistfuls of food to his face, much of which came out as he chewed with an open mouth. Another came dressed as a judge. He really leaned into his role at the party and offered zingers like, "Well, that's the stupidest idea I've ever heard," or, "Do you have mirrors in your house?" I came dressed as a stick of dynamite. I try to control and hide my explosive anger, but I also leaned into my character at the party. If people came up to me, I'd yell at them. We partygoers talked about how liberating this was. There was freedom in inviting the unwanted part of ourselves to the body, giving them a voice and letting them be seen. So how about giving a pencil to OCD and letting them tell their story? You can print out a second worksheet and that's for them. So go through the same scenes of your story, except now let OCD give their perspective. I want to offer you a third idea, and that's to prove to OCD and to yourself that you are not stuck. You can take one tiny step today as evidence. Find something small that OCD wants you to say yes to and instead say no. If you're coming up with blanks, here are two specific ideas. The first is to contribute to the OCD Confessions campaign. OCD wants you to keep secrets. Break the silence. Here's how. Get a postcard and on the back, write down a secret. Get out the markers and unleash your artist within. Then mail it to me anonymously. I'll leave you a link so you can find the address. Not only will it help you, it will help others who can look at these postcards and say, "You know what? I am not alone." Your second idea is to enroll in the Get Unstuck from OCD 5-day challenge. Over 5 days, I'll send you some self-coaching tools that will help you get unstuck. Now, if you've ever tried to unwind a ball of knotted charger wires or even a knotted extension cord, it can seem overwhelming. There's a way of doing it, though. So if you're stuck in the web of control of OCD, you might think that you've tried everything. In this 5-day challenge, you'll see how maybe you can free just one little pinky. then you can use the same process to free your hand and then your arm and then your torso. But most importantly, you'll have evidence that you don't need to stay stuck. If OCD is in your life, you get to choose your future. Many OCD warriors can't see any way out of the pain. If you're an OCD warrior and you're choosing the Disneyland option, this is your right, just like it was Naomi's right. But I'll remind you that Naomi only saw two choices: more of the same treatment that didn't work, or no treatment. Please know, though, that for OCD, there are more than two choices. Explore these other choices before you decide. If you're an OCD champion caregiver, please remember that the only person that you can control is yourself. As much as you might want to influence your OCD warrior into making better choices, your way of getting unstuck is releasing control. It's understanding that the only person you can control is yourself, and you have the power to make different choices. You are not stuck. There are lots and lots of ways to being freed from OCD, to saying yes to your life, even when OCD is part of it. Well, thanks for joining me. I hope that you found value in this episode. If so, please feel welcome to share this with family and friends and community members. You can find the links below to join the OCD Confessions campaign or join the Getting Unstuck from OCD Challenge. You've got this.